As the government of St. Lucia, via the Ministry of Health and Wellness, advanced commissioning plans for the Owen King EU Hospital, staff associations and unions representing workers at the Victoria Hospital were specially invited on a familiarization tour of the facility on Thursday, 30th March. In attendance were executive members of the National Workers Union, the St. Lucia Civil Service Association, the St. Lucia Nurses Association and the St. Lucia Medical and Dental Association. Deputy Permanent Secretary in the Ministry of Health, Verena Calderon, indicated that the objective of the tour was to provide the unions the opportunity to see firsthand the working environment at the Owen King EU Hospital and to clarify any queries or concerns of their members pertaining to the new environment.
We got a good feeling from them. They were very happy for the tour, and they had some questions which we hope to answer, and we will, any recommendations made, we will try to bring them on board to ensure that when we open, everyone will be comfortable.
Deputy President General of the National Workers Union, Solis Myers, thanked the Ministry of Health for affording the union its first tour of the hospital. She shared her impressions of the facility and the expectations for her members.
For us, what we will say, it is very impressive in terms of what we had before and what we're coming to. In terms of the technology, we're very happy to see that everything is state-of-the-art and up-to-date. And we're really looking forward in terms of what this hospital can mean to St. Lucia, not just for the general public, but in terms of the regional services that can be offered. In terms of our members, obviously, one of the most basic things right now in terms of what we've seen so far is the training, especially in terms of the equipment, what would be expected of them, etc. So we're really interested in finding out how what plan, what training plan or strategic plan that the board and the management and the ministry have in place as it relates to the training of the staff, the maintenance of the equipment.
CSA President Yvonne Edwin articulated the primary concerns of her members as it relates to transitioning to this new facility.
You want to ensure that the members, they are treated fairly in terms of the transition to this new facility. Obviously, they would need to adjust. There are requirements for an orientation, so to ensure that they're familiar with this new surrounding. I think these are the primary concerns. So once these are clarified, I think transitioning into the hospital is progress for St. Lucia, and it is one that the union will continue to support.
Newly installed President of the St. Lucia Medical and Dental Association, Dr. Alphonsus St. Rose, though generally impressed with the facility, had some concerns with the workflow design and layout in some areas of the hospital. He also highlighted the high maintenance cost of this facility.
My greatest concern here is how are we going to maintain this facility? I think that's a nightmare for anybody who's going to take on this facility. I think it's a nightmare.
The high maintenance cost of running the new hospital has been acknowledged by the government of St. Lucia. Via the Ministry of Health, government has issued expressions of interest to partner with private sector service providers in outsourcing some of the services required at the Owen King EU Hospital and associated medical facilities. This is to ensure that the required services are delivered to the healthcare system with maximum efficiency at an affordable cost. From the Ministry of Health and Wellness, I am Glenn Simon reporting.